Hello, my name is Yanko Limon. Today I'm going to talk about a drug recently approved by the FDA in the year 2021. The brand name of the drug is Livtencity. The generic name is Maribavir. It was developed by Takeda Pharmaceuticals. Once again, the brand name is Livtencity. The generic name is Maribavir. What is it used for? What's the indication? This drug was approved by the FDA in the 23rd of November 2021 to be exact. It is used in the treatment of cytomegalovirus, CMV, infection or disease. Once again, this drug is used to treat CMV infection. The primary patient treatment group is post-transplant patients, solid organ transplant. If any of you have ever worked in a transplant unit or with transplant patients, CMV is probably an infection/disease that many of you are familiar with. It's one that tends to affect these patients quite a bit. CMV is a virus that most of us have it. We just don't know it because we have a healthy immune system that is able to keep it at bay. However, because post-transplant patients are on immunosuppressive drugs so that they don't reject their graft, they are susceptible to infection. This drug is used as a last resort when standard treatment antivirals like ganciclovir, valganciclovir, cidofovir, and foscarnet were ineffective. Once again, this drug was developed as a last resort when standard treatment antivirals were not effective for the patient. This drug was developed for both adults and pediatric patients. Pediatric patients must be greater than 12 years old, and they must weigh at least 35 kilograms. Mechanism of action. How does this drug work? This drug is a benzimidazole riboside CMV PUL97 protein kinase inhibitor. What this drug does, it attaches to the PUL97 encoded serine 309 kinase at the adenosine triphosphate ATP binding site. Essentially what this does, it prevents phosphortransferase activity that is required for the virus DNA to replicate, encapsulate, and nuclear egress. To make the long story short, basically what this drug does, it doesn't allow the transfer of cell energy, in other words, ATP, that is required for the virus to perform its existential function, which is essentially, it doesn't allow the virus to replicate. For those of you who like diagrams and illustrations like I do, I was able to find this diagram from the Takeda Pharmaceuticals website. This is a mechanism of action in picture form. You can see how the virus enters a cell and it tries to do its thing of replicating, but the drug, you can see there how it attaches, how it works to prevent the virus from replicating, and it doesn't allow the virus to encapsulate and continue to exist. So for those of you who love pictures like I do, there you have it. I'll leave it up there for a moment longer if you want to look at it, but that's how it works in picture form. Side effects. During the clinical trials of this drug, they found that dysgeusia, also known as taste disturbance, was the most prevalent side effect. 46% of subjects/patients that were in the clinical trials, this is the major side effect that was manifested. The other one, 21% of patients had nausea. Then 19% was diarrhea, 14% vomiting, and 12% fatigue. Once again, the major side effect of this drug is taste disturbance. Adverse reactions. Adverse reactions related to this drug are primarily related to any kind of concomitant medication that the patient may be taking. For example, some drugs that the patient may be taking may weaken the effect of Livtencity. Livtencity. Um, Livtencity also has the potential to increase concentration of immunosuppression drugs, for example, tacrolimus, sirolimus, everolimus. Hence, the level of those immunosuppression drugs, make sure they are checked regularly to make sure that they're effective enough. Other concomitant drugs to monitor are drugs in the class of antiarrhythmics, antimicrobacterials, anticonvulsants, HMG, CoA reductase inhibitors, and herbals. Other adverse reaction includes virologic failure because of resistance that may occur during treatment with Livtencity. A virologic relapse may occur 48 weeks after ending treatment. What this basically means is that once this drug is stopped, essentially the virus may relapse and take hold again. So that's one adverse reaction to be aware of. Also, another adverse reaction is a cross-resistance to ganciclovir and valganciclovir. If you guys remember from pharmacology, there was some cross-resistance to some antibiotics. So this kind of has the same kind of thing going on. Livtencity has cross-resistance to ganciclovir and valganciclovir. So one adverse reaction to be aware of. Contraindications, black box warnings. There are no black box warnings related to this drug. Livtencity should not be co-administered with ganciclovir and valganciclovir as it may inactivate them. In regards to pregnancy, there's not enough data on pregnant women, so to be safe, contraindicated if pregnancy is in effect. So if pregnant, probably shouldn't be taking this drug. Patient education. One thing that to make sure that when you educate your patient, make sure to go over with them why they are taking this drug. A lot of times, as a 14-year nurse, I've encountered patients who are taking drugs and they don't know why they're taking them. So always make sure to reiterate, hey, this is why you're taking this drug. So patient education-wise, always make sure they know why they are taking this drug. Patient can take this drug by mouth, obviously. If the patient has trouble swallowing, it is okay to crush this medication. Once again, if the patient has trouble swallowing, they are able to crush it and put it in applesauce or pudding. This drug can be taken with or without food. Once again, this drug can be taken with or without food. Tablets come in 200 milligrams. The standard dosing is they are to take 400 milligrams every day. However, the 400 milligrams is divided in two. Hence, they will take one 200 milligram tablet in the morning and then one 200 milligram tablet at night. I always tell my patients, always try to take it at the same time. And I always like to tell them, hey, you're going to be taking a total dose of 400 milligrams. However, they're divided in two, one in the morning, one at night. So make sure that you go over the math with them, how many times they are to be taking this drug. Because this drug is primarily for transplant patients who by default tend to take many drugs, it's always good to talk about possible drug interactions. Once again, drug interactions is a big deal with this drug. Make sure to review with the patient, and tell your patient that they make sure they let the doctor or us know, the pharmacist, what other drugs they are taking. We have to have a list of the drugs so that way we can check for any adverse drug interactions. So once again, when you educate your patient, make sure that they bring with them a list of drugs. That way we can check for any drug interactions that may exist. And if they are taking certain drugs, if we find that there may be drug interactions, this will tell the nurse, doctor, pharmacist if they need to increase or decrease, certain drugs or take them off certain drugs. So once again, educate your patient. Make sure that they let us know what other drugs they're taking. Other things to make sure to review with your patient is side effects. The main one for this drug, obviously, is dysgeusia, taste disturbance. Once again, make sure to review with them side effects. That way, they're not caught by surprise. Another thing to make sure to go over with your patient is if there's other side effects that were not mentioned in the brochure that they need to let us know, just so we can kind of go over that. Make sure to tell him, how to store the drug. He's supposed to be at room temperature. What to do if there's a missed dose. What to do if overdosed. There is no antidote to this drug, so if the patient or if a family member happens to take this drug and overdose, best thing to do is to seek medical attention and monitor the patient, per my research. And there you have my references. And that is it. Once again, the name of this drug is Livtencity, also known as Maribavir. All right. Thank you very much.